I'm Dr. Steve Lininger, proprietor of Manassas Chiropractic and Rehab. Today I'm going to tell you a little bit about something that is commonly misdiagnosed even among physicians. It's called carpal tunnel syndrome. Now you've all heard of this because everybody knows it as wrist pain, hand pain. Even doctors today tend to throw it anything that's diagnosed with wrist pain, hand pain, they just write it as a carpal tunnel diagnosis, when really the true definition of carpal tunnel syndrome is entrapment of the median nerve within the wrist specifically. So let me show you where that is. This is the wrist, and there are several nerves in the wrist: the ulnar nerve, pudendal nerve, or not the pudendal nerve, the peroneal nerve, well no, that's in the leg. The median nerve and the ulnar nerve are the main ones. Then you have these branching off it. You also have axillary nerves up here. You have the radial nerve that goes behind the elbow. The median nerve travels directly through the carpal tunnel in the wrist and into the fingers. So entrapment of the median nerve, or true carpal tunnel syndrome, is compression of the median nerve in the tunnel, in the carpal tunnel, and that's caused by calcification around the median nerve. But that's, it's common, but it's more common for a physician to just say, well, your wrist hurts, you must have carpal tunnel, I'm writing it down, I'm referring you out, or I'm going to recommend these pills, or I'm going to recommend an injection. Here's the problem. If the patient is having bilateral pain in the wrists, so that means both wrists are hurting, what is the chance or likelihood that they're getting peripheral nerve entrapment of the medial nerve at both sides at the same time in their life? Not likely. What's much more common when you investigate a little further is that the patient is also having radiating symptoms, not just in the wrist, but they're having numbness, tingling, pain in the arms, both sides, or one side if it's only on one side. And it can caused by thoracic outlet syndrome here, or it can most likely it's caused by a disc or nerve root in the neck. Okay, so when I have a patient come in telling me they've had carpal tunnel surgery and they're still having pain, many times the doctor will actually tell them, well, let's cut the other side open because that's where you're having pain too. But the real problem isn't in the wrist, it's just the fact that the doctor hasn't gone further to think through the second steps of radiculopathy, myelopathy, compression of the root of the nerve at the neck itself, the shoulder, impingement at the elbow. Where is the impingement? So first, we're gonna follow the median nerve up through the elbow and see if it's entrapped here. We're going to follow it to the shoulder joint and see if there's entrapment here. And more commonly, we're going to see, if it's bilateral anyway, that means both sides, we're going to see entrapment at the neck, usually at C5, 6, or 7. And that's the most common condition that I see. That's called radiculopathy, which can cause symptoms in the wrist and hand, and a patient, and even a doctor, can call that carpal tunnel syndrome, but it's misdiagnosed. And that's why they need to get a neck x-ray or MRI in most cases before they go get a surgery. But unfortunately, many times they come in and they've already done the surgery. So I always examine the neck along with the wrist and the arm. I'm Dr. Steve Lininger. Now, if you're having carpal tunnel symptoms, or someone's told you you have carpal tunnel, I will recommend that you get a second opinion before someone starts cutting on you. You can reach me at 703-396-7770. We're here in Manassas at 8214 Centerville Road, Monday through Thursday. Again, the number is 703-396-7770. Thank you very much and have a nice day.